Parkinson's disease is a common neurological disorder, which is characterized by tremors, stiffness, and slowness. This condition can be effectively treated with medications. However, in some patients, medications lose efficacy, and patients can develop motor impairment and dyskinesias. The University of North Carolina at Chapel Hill leads the way in developing a new treatment for Parkinson's disease. Dr. Vibhor Krishna, Associate Professor of Neurosurgery at UNC, introduces this new treatment.
Focused ultrasound is an exciting new treatment for patients with neurological disorders. This treatment is exciting because you don't have to make incisions on patients' head, and patients go home the same day after treatment. This treatment is FDA approved to treat patients with essential tremor and Parkinson's disease. Focused ultrasound harnesses the power of multiple ultrasound beams. Each one of these is harmless to the brain. When thousands of these combine at a single spot, you can very precisely ablate brain areas and improve patient symptoms.
Those neurons from the substantia nigra normally would send dopamine that interacts with the globus pallidus in one of two general pathways to properly balance the speed and accuracy of our movements. When that balance is disrupted in Parkinson's disease, especially over time, the dopamine that we replete through medication leads eventually to excessive movement alongside other motor impairment already present in the condition. The introduction of focused ultrasound to ablate the globus pallidus is a welcome tool to help us reduce that excessive movement while providing us a chance to still utilize dopaminergic therapies in our patients with Parkinson's disease while having fewer complications.
It's a great pleasure to announce the commencement and the start of a wonderful new technology at UNC. We recently acquired the high-intensity focused ultrasound, which opens up new horizons for the treatment of patients with neuro-oncological disorders like brain tumors, where we can optimize the delivery of agents to treat these tumors using the ultrasound. Furthermore, it is opening up a new opportunity for us in the treatment of Parkinson's disease, essential tremor, and other functional disorders. The beginnings of the new trial in the New England Journal of Medicine, where we demonstrate the tremendous potential of this technology for treatment of patients with Parkinson's.
In this multi-center trial, 94 patients were randomly assigned to either ultrasound treatment or sham treatment. We observed that significantly more patients reported improvement in their motor symptoms and dyskinesias after ultrasound treatment. Importantly, these improvements were sustained up to 1 year after treatment. We also observed side effects after the treatment, most of which were mild and transient.
Talking about the future of incisionless neurosurgery, Dr. Oyesiku adds,
Well, that has been the thrust over the last decade and a half or more, where we have new technologies that are less invasive, that can be done with less risk, more precision, with more speedy recovery for the patients.
Over the past decade, ultrasound technologies have advanced faster than perhaps any other modality, driven largely by advances in electronics hardware. Biomedical engineering has been a focus of cutting-edge ultrasound technology development for nearly 20 years, and we are excited to continue our work with our clinical team to bring novel, focused ultrasound therapies to the clinic in order to improve patient lives.